It's not going to load. I can tell you right now.
Hello, this is John.
Hi, John.
All right. Policy and governance will be called to order. Roll call. Joe Blau is in attendance and Miles Davidson is here. Is anybody from District 2 anywhere? Doesn't appear so. Item number 1, discussion and action, possible action to set date, time, and place meeting will reconvene in the event of technical difficulties. Joe, you got any suggestions?
About 1 o'clock today.
I will second that motion for 1 o'clock today on Tuesday, April 14th. All in favor, Joe, Mr. Blau, Davidson, aye. And motion clearly passes. Item number 2 is approval of the minutes of 14th, 2020.
I'll move approval.
I will second. Mr. Blau.
Aye.
Mr. Davidson, aye. Item number 3 is discussion of possible action to recommend to BOCC the approval of resolution 1386, encouraging residents of Oklahoma County to be a good neighbor. Joe, want to take it away?
Okay. Well, as you know, this BOCC sent this to Policy and Governance last week pursuant to the policy that they had adopted. However, I'm a little confused. My understanding of the policy adopted by the BOCC was that it was with policy decisions of the board. This is just simply a resolution encouraging the residents of Oklahoma County, whether they be in incorporated areas or unincorporated areas, to follow the guidance of be it CDC, state health, in our case, Oklahoma City County Health, and their local governmental authorities, state governmental authorities, and national governmental authorities, to try to stop the spread of COVID-19. There is no directive here. It's just simply encouraging our residents to maintain the good work that they've done in trying to slow the spread, flatten the curve. And it's just simply a statement of the board in support of continued efforts to do so. So there's no policy here.
Is this one different than the other one?
It's the exact same thing. I'm a little concerned that perhaps there was some confusion over what this really was. I've heard some concerns that it might be stepping on the governor's toes. Encourage people to follow the guidance of the governor, Mayor Holt, the mayor of Edmond, other municipalities within the county. So it's just a simple resolution saying you're doing a good job, be a good neighbor. Much like an article that Commissioner Calvi wrote talking about the Oklahoma Standard, encouraging people to help out, reach others, and do the right thing in this time. Nothing more, nothing less. So I'll move the approval, or that it be recommended to VOCC.
I will second. I think this is fine. So, Mr. Blau,
Aye.
and I vote aye. All
Fair
right. Number 4, discussion, review, and possible action regarding an update from the director designate of VOCC Emergency Management. I was really hoping Mr. Barnes would be here. Have you heard from him this morning at all?
I texted him a couple times. I believe he's remote.
Okay. The concern I have, I shouldn't say concern, I've got questions. I noticed on the Oklahoma County Sheriff's Office FOP 155 Facebook this morning, they posted that they had made a call for PPE to the county for detention officers and officers. I was not aware that they had made this call. It was the first I was learning about it, but they were kind of essentially taking a swipe at us for not acknowledging their request. I don't think that there had been a request from the sheriff's office that I'm aware of, but my big question was if they have had a request, Mr. Barnes, for the PPE, because it's all supposed to be being ran through our emergency management director of every county in the state. And if they have, what was their success in getting some of that PPE to them? If Mr. Barnes is watching at home, I'd just like to, if he could email or text us and let us know that they've made that request and they're trying to fulfill that request with some PPE, I would appreciate it.
And Miles is with.
Because I definitely think they need it.
If we don't get that in this meeting, we can at noon, and
Yeah.
I don't do Facebook, so this is the first I'm hearing of a request or something of this nature. And I do believe David mentioned, as you said, that his office was now going to be a pod for entities within Oklahoma County, and I believe a couple other counties as well, and that those supplies were flowing from the state. And I thought I recall, maybe David said he would be getting, or could be a distribution point for the sheriff's office and juvenile. But I thought maybe he said they had already distributed some things there. So I'm uncertain as to my. Mr. Matthews is confirming that at least some PPE has been provided to. Interesting.
That was weird.
Someone's trying to call the iPad up there. Some PPE has been delivered to the Oklahoma County Sheriff's Office as well as our juvenile bureau. So if we don't hear from David for this meeting, certainly we can find out at noon, because I do want to set the record straight on that.
Yeah, that was my whole purpose was set the record straight. And if they haven't, let's get on that, because those individuals inside that jail, the detention officers absolutely need it, and our first responders, the sheriff deputies out patrolling down in corporate areas certainly need it as well. So with that, I don't know that.
Let's move to receive our report.
Yeah, sounds good. Second, Mr. Blau.
Aye.
Mr. Davidson is aye. Weird talking about myself in third person. Discussion, review, and possible action regarding an update from VOCC Engineering Department. Mr. Brand.
Yeah.
Hello, Eric.
Hey. I don't have any information to provide for engineering unless you have any questions.
I think we had a pretty good meeting yesterday with Mr. Trumbo and our infrastructure PBA, and probably got some pretty good updates from that. So I appreciate you attending, but why are you here?
I'm here for planning too.
Okay.
Okay, so with no action, Miles?
I believe no action is probably correct. Thank you, Eric.
Planning. We continue to work on the revision of the county subdivision regulation. I sent out an email to everybody let know that we're looking for input. I've gotten some from Mr. Cardwell. I know we had set up a meeting in District 1 on Friday that we had to reschedule, but so we're just looking for input so we can wrap that project up. We're going to try to provide a rough draft to the Planning Commission this Thursday meeting. They have an opportunity to read over it, let us know any of their concerns. And then hopefully around May time frame, we can have all that wrapped up. And then we'll kind of see where we go from there as far as public meetings at that point. May have to delay that for a little while due to the current circumstance. So that's the main thing we're working on. The other thing is Precho, phase 7. We're still waiting on reimbursement of phase 6, which hopefully that'll be within the next couple of weeks. And then once we have some money, phase 6, we'll move forward to phase 7. In the meantime, we've been waiting for reimbursement. We've approached some property owners out there. We have offers to sell on one, and we're working on 2 other ones right now, where as soon as we have the money in hand, we can bring these properties forward quickly and get those closed. Move forward with that. Besides that, we have a Planning Commission meeting this Thursday, and we have one item on the agenda for May. That's all the information I have. Unless you have
Yeah, a couple. With regard to the planning commission, are the planning commissioners, they all have the ability to teleconference in?
I'd have to ask Tyler about that. From my understanding, they're actually going to be here this Thursday, so I don't know if they're going to teleconference in or not. I haven't spoken with Tyler about that, but my understanding last time, which was a few weeks ago, they're going to be here. So obviously that may have changed since I talked to Tyler last.
Okay, and then on Cretcho, you mentioned the phase 6 reimbursement, which is, unless something changed, a partial reimbursement because we have a tenant issue. And my question is on the tenant issue, is there any movement there, or are we?
No movement. We still can't locate him. Like I said, if that continues to be the case, we have to at least go until November of this year before we can close that out.
Okay, all right. Thank you for the update.
Just a quick question about the planning department. How far, not planning department, the committee, how many are on that committee?
The Planning Commission, there's 4. So there's Commissioner Bloomer, there's Bob Talbot, there's Denise Patterson, there's Charles DeFuria, and right now, Amy Martin. Oh, I'm sorry.
So there's 2 vacancies. There's an appointment on for the board to consider on Wednesday, and then District 1 is looking for a replacement for one of the folks that signed that we have.
I was just thinking that's quite a few people to be up here. And if you or Tyler or whomever can reach out, see if they have the ability to do the remote, and if not, if we could get with the clerk's office to see what we can do to help them reach or be able to have that ability to do the teleconference, that would be great.
You know what, we need to check their models, whether or not they posted the ability for them to.
Yeah, that's probably, do you know that answer?
I would
I
assume
didn't even think of that.
it's probably not.
Okay,
Yeah.
exactly.
Planning Commission?
Thursday? I don't think it is.
And it's got to be done 48 hours in advance, or probably past that.
Okay. Well, I would encourage you all to work with the planning commissioners and all meetings going forward, for however long this might last, that we at least post with the ability for them to appear via video. Okay. All right. Thank you, Eric. Okay. I move to receive the report. Oh, sorry.
Just one more. Do you intend on having a quorum for this meeting?
Yes.
Okay. Second.
Well, I,
Davidson, aye. Item 7, discussion, review, and possible action regarding an update from VOCC HR Health and Safety. Mr. Matthews, you're here 2 days in a row.
what can I say?
You're supposed to be at home.
Well,
Telecommuting.
slept there last night.
Well, I know, okay.
Good morning.
He does in his office.
No doubt. No doubt. Is on?
That's all.
Continuing to work here and at home. All of my staff is working at home, talking with them on almost a daily basis. And they're continuing to conduct business as much as normal as they can. My main focus has been the Emergency Response Committee. I've been working closely with, especially the Sheriff's Department, with a number of people that they have that have potential exposures. And talking with them, we're looking at every case individually to make the decisions on what to do. I had a conversation with Chief Deputy Ricky Barrow yesterday, or last night, and again this morning, in dealing with a couple of potential exposures there. Nothing confirmed, no positives, but whether or not to self-quarantine or have other self-quarantine. So we're doing that on a regular basis. So that's the main thing. We're just continuing to try and support our elected officials, their departments, their employees, and meet with the committee on a almost daily basis now. Any questions?
I've got none.
Motion received.
Second. Mr. Blau?
Aye.
Mr. Davidson's aye. Item number 8, discussion review and possible action regarding an update from Social Services Department. I didn't hear from Christy, and I don't think she's one of, oh, she is one of the ones up there. Christy, you're muted, it looks like. If you would like to, there you are.
All right, can you hear me now?
We can hear you.
Hi, Tracy.
Hi. Well, since David has been providing a lot of updates on what we're doing, I thought I would just try to add some on top of what you already know. For one thing, just so you know, all of the shelter guests are screened and they're all wearing masks. And they've been actually very, very good at being compliant with that, washing their hands very frequently. And they've been really good at encouraging each other. If somebody is not wearing their mask or not doing what they should, the others will, in a nice way, actually are being, they're just acting as a team and making sure that everyone is being safe. So that's been a good thing. We're working on setting up telehealth stations in all of the shelters, just in the event that that level of service is needed. And that's for both physical health and for mental health situations. And so I think that mental health side is really critically important in this particular situation. We're talking with someone about on-site testing capabilities for the shelters, so that's a good thing. Sent some discharge instructions to the hospital so that they will know how to handle situations when they're discharging someone who is homeless, so that they're not just turning them out, so they know exactly what to do in those situations. Daily outreach is being done to those who are not in the shelters, taking them food and supplies so that they aren't having to come in for services. And also screening and telehealth is available with that as well. There's some discussion of getting some tents for those situations where somebody who is out there in an outlying area, not in shelter, but needs to have a means to isolate, to have some tents available for those types of situations. And then the last thing that I just couldn't remember if I had mentioned or not about this, but when it comes to people who are experiencing homelessness, infectious disease tends to hit this population later than the general population, typically by anywhere from 2 weeks to a month after. You'll see that wave happening. And when it does hit, it tends, for obvious reasons, to hit them really hard. The flu was really bad this year in the sheltered situation. So anyway, those are just some things above and beyond what I think David has been able to keep you posted on. So do you have questions about any of that?
No, ma'am. Yeah.
No, Christy, thank you for that good update.
Christy, I do got a question about something unrelated to that. This time of year, we're kind of looking at community support grants typically. Doesn't that crank up usually about this time of year? And if so, what is the new norm going to look like for that process?
Well, we were working through that with the district attorney's office on what that would need to look like. And we were partway through when all of this hit, and I've been pretty wrapped up in the shelter situation since. So we're not all the way there on that yet.
Okay. All right, great. If nothing else, is there a motion?
Motion to
There's a second, Mr. Blau.
Aye.
And I am an aye. Thank you, Christy. Thanks for calling
Thank you. Thank you.
Item number 9, discussion, review, and possible action regarding an update from VOCC Facilities Management Director, Mr. Monroe.
Some question from my admin working at home, whether or not we can compete with daytime TV. So clever infomercials or spice it up just a little bit. I've got one working from home. The rest of us are here. There is some issue with accumulated leave and the possibility of some employees who are here, have to be here, losing time at the end of the fiscal year. I've talked with Dan Matthews about this a little bit, and we need to probably discuss.
That's essentially the use or lose once you bump up to that 450 or whatever it is.
Yes.
Yeah, I knew that was, I mean, I'd had those discussions. I'm sure your office has had those discussions as well, so.
Yeah. I asked, probably you as well, Dan, to review the statute related to that, see if there was any leeway. The other option is to see if OMS has issued any temporary guidance, because the state would be facing a similar issue for its employees as well. So
I believe that 450, absolutely. Please. But that 450, isn't that self-imposed?
No, 480.
480, thank you.
240 for the first 5 years, and then 480 after that. And no, it's not self-imposed. It's in the state statutes.
Okay.
I did talk to Marla about it, and she said she doesn't see any way around it. However, under the current emergency declaration, I guess that the governor has the ability to waive those rules. But I don't know that for a fact, but that's what she had said was, here's the emergency declaration. Perhaps that would help. So I don't know if you guys have got contacts at the governor's office that maybe could push anything or push through anything, or talk to someone about those rules. But it's a concern with a lot of people. I've also been talking with the sheriff's office about some of their folks that cannot take leave right now because they're critically needed.
And so, with regard to the declaration and the wording and looking at the act, appears to be some question as to whether or not what Dan is mentioning would even get down so far as to local government. I think the wording of the statute is something similar to waive regulatory as it applies to state agencies.
Yeah, in response.
In response, yes. And so whether or not if OMS were to do that, it would trickle down this far. Of course, I say this a lot.
The other potential option is that it gets paid out. Anything in excess be paid out.
Yeah, but you still need statutory.
That's the word I did.
Okay. Well, I know we can on comp time. We have that ability to do that.
Yeah, but there's a specific statutory reference to the comp time for like DOs and law enforcement.
Right.
Those in that category. I have a thought. I'm not willing to throw it out just yet on how we might be able to deal with this. I need to look at it.
You know, the legislature granted us the new powers that we reside under for the Open Meetings Act. Did so swiftly and easily. We cannot be the only county in this state facing this situation. I'm kind of curious if a call to ACO or something similar to earn some sort of temporary statutory ability to exceed the 480 could be in order if that's something that we would want to do. Or honestly, I haven't talked to a legislator in probably 2 weeks, and I don't know what their plans are about coming back or anything. So,
Yeah, Miles, I think certainly that's a good possibility. I think maybe we need to take a little bit of time. There's some ramifications.
yeah, especially with payouts.
Correct. And so maybe the good thing is it's only April 14th. The deadline is June 30. We got a little bit of time to look at this issue, I think. And I think if Dan will continue to work on this, and Keith, if you'll let your employees know, and not just your employees, but the employees from the sheriff's office, Juvenile, who are facing a similar situation, that we're looking at a way to try to address this, and we understand the impact it may have, but at this point in time, it doesn't appear that we have an ability to address it.
And I think in response to that, I'll have to begin cycling necessary personnel out in order for them not to lose time or as much time.
I don't know that you need to do that yet. I don't know that we've reached that point yet. I would say give us a little bit of time to see if we can work through this, and then maybe address it.
And I think the
later
first
date.
And to piggyback on what Miles was saying, the first step in that, if you haven't, if you will provide Dan a list of where your employees are at, as we currently said, that are above the legal accumulations, that'll help give us some idea as well. And when you might need to start implementing some of those.
Is there a way to get a rundown of that?
Sure.
I mean, not just your office, but county-wide. I would be kind of curious to see what we're. Yeah, just county-wide, and how many are going to be over that 480 and.
Yeah, I think that probably I'll have to kind of search units.
Dan, explain to me how it works. So in the system, in Munis, it says you're only allowed 480. Does it go to like 520 or whatever, however much you've accumulated for that year?
You can accumulate as I understand it, Miles, you can accumulate above the 480 in the year, but you have to use back to the 480. You
Right.
can't have a balance.
That's right.
Right.
It
Yeah.
shows that number.
On June 30, you have to be at 480 or 240
Right.
if you're under 5 years, and but you can go over it during the year. But as I understand it, once we get to June 30, anything over the 480 comes
Just goes
off.
back down to 480.
Yeah, and I don't know if that goes into a memo file anywhere. I can ask Erin Spitzer. She's certainly a lot more knowledgeable of the payroll system and all of that. I'll check with that, but we'll work on getting a report on accruals that people who were bumping the 480 or the 240 if they're under 5 years.
I mean, that's a big number. 480 is. So just kind of curious how many people would be over it, what we're actually dealing with. I'm not worried about you.
Thank you.
Absolutely.
I'll tell you that there are people in our department who routinely lose time.
Yeah.
That's all I have.
All right.
Motion to receive.
Second.
Well, aye.
Davidson, aye. Item number 10, discussion, review, and possible action regarding an update from the Oklahoma County Juvenile Bureau, of which we have in front of us. And thank you to Ms. Overstreet for sending that. Briefly, the Juvenile Bureau has received PPE from OJA and Oklahoma County Emergency Management, have approximately 300 masks. All staff and youth are wearing the mask. They were nominated and recognized as first responders by the Dodger Baseball Foundation. Commissioner Calvi and Ackerman, president of Oklahoma City Downtown Rotary Club, delivered hand sanitizer on the 9th. Since March 25th, they've had 8 detention staff call in with fever or turned away after reading over 100.4. On site, please. I didn't see the, okay.
During the month of March, Miles, there was a noticeable drop in population. Looks like we started off the month at 60 and we ended at 31 and 42. I think what it appears the thing that's keeping that number up there is the YO. It's a unique situation. Yeah. Do you have this for the record?
Was it my attached
Motion. Yeah, do a motion to receive.
Second.
Well,
Davidson, aye.
and motion to receive report.
Yeah. Essentially. Joe, do you have any discussions with, I know that you and your office has always spearheaded this contract with the state, all the intricacies that reside within it. Do you know where we're going to be at for upcoming year?
In a previous email with the now, at least interim director, there was an indication that they were going to drop that number down to 55.
50?
50. 50. 50.
Yeah, that confirms.
And that would fall in line with the discussions that have been had over the past 2 years that we keep telling the board that OJA's desire is to move away from the detention setting to more of a group home or alternative care. So the 50, what makeup that would be, whether that would be 50 for Oklahoma County and then some options for regional beds on top of that, or the 50 total is inclusive of county and regional vet status. We've not heard anything. I'm sure like OJA has been swamped in trying to deal with this health crisis.
Yeah.
Probably, if we haven't heard from them, we'll reach out to them and try to set something up, figure out what's headed. And keeping in mind that, you know, federal law has changed. So beginning in 21, December, bios, no matter what they're charged with, will no longer be able to house in a adult facility, even with sight sound separation. So what that looks like, where that status is, what their status is, because they're so youthful offenders and Title 10 illustration, I remember. The YO status is within the juvenile code, and whether or not those kids are eligible for the 85% or not, it's something we're going to have to look at. And we've had some preliminary discussions with Aaron on how we might frame those questions.
Yeah. There was a motion and a second on item 10 regard receive update. Mr. Blau?
Aye.
And Mr. Davidson, aye. Item number 11, discussion, review, and possible action regarding an update from the Director of Youth and Benefits Department. Was that the gentleman? There he is, Mr. Wilkerson.
Can you hear me?
Yes, sir.
Good. Just a couple updates. First, we're still working remotely for the most part. Still receiving calls, emails, etc., and having to go in weekly to handle mail and retiree payments and reconcile some other things. And we still are responding via mail, all the required notices legally that we have to in a timely manner. So handling everything remotely for the most part. Going in some to handle the other things. Really, the only other updates I have is there's going to be 2 plan amendments on this budget board this coming Thursday. We were ahead of the curve amending the plan, if you remember, last month. And what that amendment did is covered all testing and treatment for COVID-19 in network at 100%. Now, since then, there's been some federal mandates that have came out, and HealthSmart has offered up an amendment to keep us in line with that, as well as all their other clients. And what that is changing, there's 2 separate amendments. The first one is changing testing to be covered out of network also at 100%. So currently we cover COVID-19 in network at 100%. This will add testing out of network at 100% as well. And then another change, and this is really just precautionary, and this is required, is if there's any greater than 34-day supply of prescriptions requested that is related to COVID, that it will be reviewed just to make sure any prescription drugs that are related to that no one's stockpiling those. And they don't see that as an issue right now, but that language has to be added. And then on that first amendment, also we're adding some language for employees that are at home due to an unexpected closure. So they're still covered as an eligible employee under the health plan. And that's the first plan amendment. So just to recover that or cover that, testing out of network is going to be covered at 100%. Stockpiling of medication related to COVID will be watched. And then the last thing is employees that are at home due to the closure will still be considered eligible employees.
Would they not?
And then the second, if they're not
So,
if they're not
John.
working regularly, no.
John,
Yes.
all of the employees by and large, are on telework status, which makes them still an eligible employee. Correct?
Correct. And in this language that I just repeated or told you about, the unexpected closure language, that's the federal language that was included in it.
And so what this is, and then if they're not on telework status, an individual elected official could opt to utilize paid administrative leave, which doesn't change that eligibility status, correct? So
Correct.
essentially what you're putting into the plan is a safeguard for our employees so that they would continue to receive coverage in the event teleworking, paid administrative leave, or some other type of leave was not available. Is that right?
Correct. Yes, correct. And we have generous leave policies, and employees are covered through administrative leave and other things like you said, Joe. And this is just a catch-all language, just in case.
And John, and I understand the reporting or the watching to make sure that drugs are not being hoarded. Is there a specific formulary that they're looking at, or is it like I won't get it right? The drug for malaria. There's another one.
Hydroxychloroquine. Yeah.
I can't say it.
Yeah, I think all those drugs that are being treated, they're watching those, and it's not an issue right now. But the Fed's kind of mandated, hey, you need to watch that to make sure not one person is getting a stockpile of those drugs.
So the hydroxychloroquine is used for other things besides malaria. Is it going to affect those individuals? Is that where you were going?
Yeah,
No.
RA and
No, and we haven't seen this because administratively, our PBM, our pharmacy benefit manager, has already implemented this, so they're watching everything, watching all our fills, and I get notifications on fills as well of amounts, and this has not been an issue whatsoever. I think it's just a federal catch-all just to make sure that a doctor's not prescribing that drug you mentioned to take it, 12 times a day where they get way over the recommended amount where it's being hoarded.
okay, all right.
Perfect. Anything else?
And the second amendment,
Oh,
yeah,
go ahead.
one more. So there's going to be two amendments. The first one is the one I just detailed. The second amendment is still COVID-19 amendment, but this is really for eligibility requirements. And it just says if anyone's taking the COVID-19 leave, which we have, of course, generous leave policies, but if they're taking COVID-19, that they'll still be covered. COVID-19 leave.
Yeah, okay. All right. John, I appreciate you and your staff and the work you're doing, helping us all stay healthy.
Well, thank you. And the good, go ahead.
Is that COVID-19 leave, is that federally mandated as well?
Correct.
That's, the leave that began August or April 1, the second, whatever the date was.
And the good news too on our inpatient admissions, we've only had one really that could have been COVID-19. It was a short stay, and the diagnosis wasn't confirmed. So, as looking on the financial impact and also on an employee impact or a member's impact, we haven't had any inpatient stays for this.
Our employees are doing a good job.
Being a good neighbor.
Thank you.
All right. Thank you, Mr. Wilkerson. Appreciate it. Unless
Thank
you
you.
got anything
Take care.
else?
No, sir.
All right.
Motion to receive.
Second.
Well, aye.
Davidson, aye. Item number 12, discussion, review, and possible action regarding an update from MIS department. I see Rich is on the line.
Good morning, gentlemen. Can you hear me okay?
Just fine. Thank you.
Oh, Rich.
Hey, guys. Really only have two updates of note. The first is update on our website. It is proceeding apace. We've seen some preliminary work, and we're pretty excited. We're getting ready to the point where we'd like to be able to show that out to the departments and the elected officials to start getting some more feedback from them on if they like it and such and so forth. The other big update was this morning we had a bit of a roundabout. We had a problem with some of our internet providers. It was determined that there was a problem on Cox's end, and it caused some internet routing issues, which unfortunately disrupted some of our VPNs this morning. That has been rectified, and everything is now working normally.
Good deal.
And that's all I have, unless anybody has any questions.
No. Second, Mr. Blau. Davidson, aye. Thank you, Mr. Stewart.
More than welcome.
Item number 13, discussion, review, and possible action regarding an update from USCC Court Services Department grant.
Give you some numbers for the month of March. Releases 94, as far as denials go, 32 denials, but only one of those was an OR denial, the rest were unconditional bond. March, number of defendants on case load 680. Jail populations, as you know, I've been reporting those, they're staying low, but of note, on the 11th, the county number was 1225, which I believe that day, that county number is the lowest we've seen. One main thing I wanted to mention is we've talked about Jail Tracker and Egypt going away. Last week, I had a good conversation with Jail Tracker, with Jeff with MIS, helped out with that as well. Based on that conversation, it sounds like, fingers crossed, Jail Tracker will be able to do everything we need it to do, even in a case management setting. Tomorrow at 10 o'clock, we have a demo online, however it's going to work, so we can physically see it. Last week was just conversation. Tomorrow is going to be physically seeing how it works, how it can work from us, and what we'll be able to do and ensure it'll do, hopefully, everything we need it to do and replace what we have. So we'll find out more tomorrow for that. Otherwise, as you know, nothing new as far as what we're doing today. Case management is being done remotely. We're running short staff to make sure everything's done and taken care of, and everything's working.
Perfect. 1225, this is President told us what the building was initially built for.
That was my
The denials, when you said the denials, you said one of them
There was only
was a real denial and the others all went to CV.
Yeah, so for the total, there was 32, but of those 32, only one was one for an OR.
Okay.
The others were for
I think additional was for the drug testing, ankle monitor.
Yeah, the more
something else.
supervision and more
Perfect.
criminal history.
Okay, so really only one denial, ultimate denial.
For OR.
Excellent. Anything?
Continue. Thanks to you and your staff. Appreciate it. The work that you guys are doing, and it's honestly, it's not work that you haven't done in the past, right? So we appreciate the work that you're always doing.
Well, I appreciate you guys.
What, yeah. I don't do that. I appreciate it. Grant, you've done a great job.
Thank you. Thank you very much. Appreciate it.
Motion received.
Second. All those in favor, or Mr. Blau?
Aye.
And I am an aye.
I'm not sure that we might not have been actually thinking on the same line.
Sure. You got any comments? Other than that?
Yeah.
I've got none. Any new business? Is there a motion to adjourn?
Yes.
Second, Mr. Blau.
Aye.
I am an aye. Stand adjourned.